Welcome to this short training for the pre- and post-procedure TAVR patient care kits. These kits were created to help you support and educate your TAVR patients as they prepare for their procedure and for their return to daily life. From the day your patients schedule their TAVR procedure and all the way through recovery, these kits provide vital support and information. Let's begin with the Preparing for Your TAVR Patient Care Kit. It includes a folder that holds the kit materials and provides an overview of the content. The main component of this pre-procedure kit is the Preparing for Your TAVR Pre-Procedure Guide. Remind your patients that the information in this guide is not meant to replace any instruction from their healthcare team. Rather, it facilitates discussions on important topics. Now, let's take a closer look at the Preparing for Your TAVR Pre-Procedure Guide. This guide contains helpful information, as well as questions that patients and caregivers may want to ask you or their doctor before their TAVR procedure. You'll see that the convenient tabbed structure takes patients and caregivers through the TAVR experience, from planning through hospital discharge. Now, let's take a brief look at the contents in the tabbed sections. Tab 1 helps emphasize to patients and caregivers the importance of partnering with you and their heart team to plan for their TAVR. It also encourages patients to do what they can to get themselves ready for their procedure. Because patients and caregivers have so many questions leading up to the procedure, this section is very important. It contains commonly asked questions and conversation starters that patients can refer to as they talk with you and their doctor. Conversation starters give your patients an opportunity to choose topics that interest them and prompt them to think of other topics to discuss as well. Tab 2 explains to patients and caregivers what they can expect on the day of procedure. It is meant to help them talk with their heart team about concerns they may have. It also includes a convenient packing checklist for their hospital stay. Tab 3 provides patients and caregivers with a broad overview of the different approaches for the TAVR procedure, as well as procedure time. Tab 4 provides brief information on what to expect after the procedure, from waking up to managing discomfort. It also describes recovery and discharge from the hospital. Patients and caregivers are also provided with additional conversation starters to review with the heart team before leaving the hospital. Patients will also be informed that after their procedure, they may expect to receive the Life After Your TAVR Patient Care Kit and their Edwards Transcatheter Valve Identification Card. The last tab provides useful contact information about Edwards Life Sciences for patients and caregivers in case they have any questions about their valve. The accompanying procedure cards describe different TAVR approaches. You can customize each patient care kit by inserting the card that describes the specific TAVR procedure your patient is scheduled to have. You can further customize each patient's kit by inserting the card for the Edwards valve that he or she will receive. Remember to make your patients aware that the kit includes important risk information. Lastly, the kit also contains a magnet that the patient can fill out with contact information. This handy reference includes important phone numbers and helpful resources. Let's review 6 simple steps that can help you and your TAVR patients make the most of the pre-procedure care kit. Step 1. Distribute the kit to patients and caregivers when their procedure is scheduled, at least 2 weeks before their TAVR procedure. Remember to customize the kit based on which procedure and valve your patient will receive. Make sure to include the appropriate important risk information. Step 2. Review the kit with patients and caregivers and answer any questions they may have. Pay particular attention to the pre-procedure guide. Step 3. Explain that the procedure card presents the specific TAVR approach the patient is likely to undergo, but that the heart team may opt for a different approach at any time. Step 4. Have patients and caregivers review the product card to learn about the Edwards transcatheter heart valve they will receive. Step 5. Instruct patients and caregivers to fill out and keep the contact information magnet in a convenient place. Step 6. Advise patients and caregivers to store other important materials in the folder. Now that we have finished taking you through the Preparing for Your TAVR kit, let's turn to the Life After Your TAVR Patient Care Kit. This comprehensive kit is designed to help patients and caregivers take important steps after the procedure toward a successful recovery. It may help them return to a daily routine more smoothly after TAVR. Like the pre-procedure care kit, the Life After Your TAVR post-procedure kit also comes with a folder that holds the kit materials and provides an overview of the content. Let's take a closer look at the Life After Your TAVR post-procedure guide. It contains helpful information, as well as questions your patients and caregivers may want to ask you or the heart team about recovery after TAVR. The post-procedure content is also divided by tabs to help patients find the information they need. Tab 1 contains information about several important topics relating to life after TAVR, such as caring for your health and resuming daily activities. This section also contains important questions and conversation starters that patients and caregivers can refer to as they talk with you and the heart team about resuming daily activities. Tab 2 highlights some key areas of importance that patients and caregivers should keep in mind during the recovery phase. Tab 3 contains general guidelines for a heart-healthy lifestyle and healthy eating tips from the American Heart Association. Tab 4 emphasizes the importance of patients scheduling and attending follow-up visits after their TAVR procedure with both their heart team and their referring cardiologist. This section also reviews what these visits may include and has space for patients and caregivers to keep track of follow-up visits. Patients and caregivers are encouraged to advocate for and monitor their health. And they are reminded to keep their Edwards Life Sciences valve identification card with them at all times and to show it to all of their healthcare providers. Tab 5 features a recovery tracker designed to help patients and caregivers monitor their recovery and track their progress. That may include how they feel overall, their pain level, weekly activities, and medicines. Additional spaces for tracking are also provided for patients and caregivers to fill out as needed based on their conversations with their heart team. Remind patients and caregivers to bring the tracker with them to all follow-up visits. The last tab describes the ways that patients and caregivers can find support during their recovery and includes a list of helpful resources. There is a special invitation for patients to join the Edwards TAVR community. The patient or caregiver can fill out the form and return it to receive communications and helpful information and to stay connected with Edwards. Encourage your patients and their caregivers to share their thoughts about how Edwards can make the TAVR community more valuable to them. Important risk information is also included in the post-procedure kit. Let's review the 5 steps that will help you and your patients get the most out of the post-procedure kit. Step 1. It is very important to distribute the kit to patients and caregivers just prior to discharge. Step 2. Review each component of the kit with both patients and caregivers and answer all of their questions. Pay particular attention to the post-procedure guide. Make sure to include the appropriate important risk information. Step 3. Be sure to review the caregiver guide with caregivers. Step 4. Encourage your patients and their caregivers to complete and return the special invitation to the Edwards TAVR community so they can receive information from Edwards. Step 5. Instruct patients to keep the wallet card in a convenient place. We hope that these TAVR patient care kits are informative and help you bring hope and support to your patients before, during, and after their procedure, and to improve the TAVR patient experience and outcomes. Thank you for all you do for TAVR patients and their families.